like two of you actually had um, typical presentations, but then there are two types of presentation about back pain, and it was because the mechanism of your back condition, like the mechanism of injury, was a little bit different, and then so the presentation was different. And then for Simone, the back pain usually comes in when you are putting more body weight on your legs when you are in standing or when you are actually walking. That is a typical presentation. And then we will not really dive a lot into diagnosis because diagnosis is helping us to um, like to determine what treatment would be applicable during the actual PT session. But then the focus is mostly about self-management. The purpose of this workshop is that. So Simone mostly exercise and then weight bearing induced. And then for Annie, it's another type which is triggered from sitting for a long time or usually in a static position for a long time. Sitting is actually one of the most typical activity that can trigger back pain to a lot of people. But then it can also be like lying down in the bed for a very long time. And then that can usually be another very typical activity or position that triggers a lot of back pain for a lot of people. So you two actually had um, different factors that's inducing your back pain. But a common picture here is that both of you guys probably have some things going on in the lower back lumbar pelvic region, which is muscle imbalance. And the muscle imbalance, like I mentioned in the handout, that's the biggest factor that's causing all of the back pain. And then we can confidently say that it's the origin, it's the cause of all the roots of all the back pain is muscle imbalance. Like a lot of other conditions, like some people had a disc problem, some people have narrowing, all those can be a long-term result, long-term consequence from muscle imbalance. That is, muscle imbalance is usually the cause of most of the back pain unless somebody got hit by a car from motor vehicle accident or any trauma related um, events. That's an exception, but then mostly muscle imbalance. It's usually the reason why a lot of people are having back pain. And then why are we having a lot of muscle imbalance nowadays? Because like we don't usually hear that from like people 2 or 3 generations before us. But then nowadays people are having more and more pain and then muscle imbalance. Why is that happening? And then it's usually because right now our lifestyle is very different to our ancestors or to the people 2 or 3 generations before us. We usually sit more, even though we are trying to be exercising, we're trying to do any sports or be active, but then compared to like people 2, 3 generations before us, we still sit more. We drive a car, go to almost everywhere, and then we sit in front of the computer or use our phones more often than before. So the lifestyle is different, and then so that's a very big reason why muscle imbalance is coming to play. And then we can also see that from the handout, back pain is actually a very, very significant issue because according to the research, at least 80% of Americans will experience at least one episode of back pain in their lifetime. And then also 65% of them will actually experience a reoccurrence of their back pain. That means they would have this thing ongoing. It's not just like having the pain and then it will be resolved in 3 or 5 days and then not coming back. 65% of them are gonna experience that continuously if they don't take any active intervention to manage that. And then the worst thing is that 10 or 15% of the people will actually be chronically disabled, which means they're not able to sit for a very long time. They are not able to walk for a very long time because the back pain stopped them. And then, so this is definitely a very significant issue. And then this is definitely the reason why we need to do some active interventions to manage this condition. And then, so back to the muscle imbalance I talked about is the biggest factor about like where back pain is coming from. And then sitting more, like I said earlier, is the main reason that's contributing to more muscle imbalance nowadays compared to before. And then so I'm going to do a very quick demonstration to see why sitting can contribute to that. And then so normally we want to sit in this position because that can automatically promote us to engage our core better, to have an erect sitting posture. But then a lot of thing is, a lot of people nowadays, they work in the office or like right now because of the virus outbreak, they are forced to work from home. They don't usually have the best setup about their chair, about their desk. The ergonomic setup is not perfect. Sometimes the chair might be too high. If the chair is too high, the situation will be kind of like this. If the chair is too high, maybe make a little bit, exaggerate that a little bit more. If the chair is too high, you can see my pelvis is significantly higher than my knee, and then it will automatically prompt me into more of an arching situation. You see that my back is actually having more arching, right? Yeah.
Yeah.
So because of that, the arching is happening that will make me having a lot of bending flexion at the hips. And then because of this is happening, that can cause the muscles at the front side of the hip of our abdomen region is getting tighter. And then usually the hip flexors, especially the psoas muscles, they're usually getting tight more easily. And then that can further feed into the muscle imbalance. And then you can also see that by not having the proper position of the pelvis, I also have too much of flexion in my knees. And then that's the reason why a lot of people, if they sit for too long, like sedentary lifestyle and then working with a lot of sitting time, usually they will have very significant hamstring tightness as well. On the other hand, if the chair is too low, and then for me to simulate the situation, if the chair is too low or if the floor is too high in this sense, you can see that my knees are significantly higher than my pelvis. And then because of this, it's prompting me to lean back, and then it's actually too much of a curl happening at the lower back. And then you can also see that it's still having a lot of flexion at the hips. And then so the muscle imbalance will still be going on and then having a lot of tightness in the psoas muscles and the hip flexors. And then also the knees are also having too much of flexion. And then that's why the hamstring muscles are usually tight. And then also because we are not maintaining a neutral alignment. And then that's the reason why it's hard to get our core muscles working. And then if we are not actively engaging the core muscles, we lose the stability. And then that's further feeding into the muscle imbalance. So muscle imbalance has two sides. One side of muscle imbalance is the tightness of the muscles, like the hamstrings and the psoas muscles. I talked about that. And then also another side is weakness happening at the core muscles. And then also a lot of the pelvic stabilizer muscles like the glute muscles behind our pelvis, they are also playing important role in stabilizing our lower back, maintaining the neutral spine alignment. The posture is definitely a thing that can feed into the muscle imbalance. It's not a direct cause, but then it can lead to muscle imbalance and then eventually lead to back pain. So that's the biggest thing. And then, so what can we do to solve this problem? And then apparently you guys probably already know the answer. And then the answer is to restore the proper muscle balance to really stop the muscle imbalance from keep happening. And then so, like I said and then showed in with the chair earlier, whenever you guys are sitting, make sure you try to have a neutral alignment of your pelvis and your lower back. So an ideal way to measure that is to see your pelvis, your hips, is about the same height of your knees or maybe 2 inches higher, just slightly higher. That can automatically prompt you to have a better sitting posture. And then you can see that my knees are not really bending too much because I'm sitting a little bit more upright. My knees are about at 90 degrees flexion bending, and then that's more ideal. And then also the hip joint is at about 90 degrees angle as well, which is also ideal. So basically the height and then the flexion angle of the hip and knees will be about 90 degrees. And then that means if you can adjust the height of the chair, if it's an office chair, if it's an ergonomic chair, you can adjust the height. That would do the trick. Sometimes if the chair is too high and then you're not able to lower the chair down enough, the thing you can do is you can put blocks on the floor to prop your legs up. That's the way to compensate and then to make the chair a little bit lower relative to your feet. And then that's the way to work around that. And then also for some people, they just don't have enough core stability, pelvic stability yet. Some ergonomic chair usually have a curled shape of their lower back. Um, like that's usually called a lumbar support. That can do the trick, but then you don't necessarily always need to do that. Something you can do is you can just find a smaller pillow or maybe a towel roll depending on how you feel. Put it right behind your lower back. And then when you are sitting, it can give you a little extra support. So by doing that, that gives you extra support, then it helps you to offload some of the stress at your lower back. That is something very easy to accommodate. And I would say that for a lot of people, if driving for a long distance is a requirement, and then having something to support the lower back will definitely really come into play very well to help somebody to tolerate the position better. So that's the positioning about sitting. And then the relation for sitting related to body mechanics and then related to muscle imbalance. And then now, other than changing the posture to help us to restore the muscle balance, we can also do some techniques to help us to relieve the muscle balance. So the first technique I would like to show you guys is the psoas release. And then so if you already have the tennis ball, this will be the time to use the tennis ball. So let me show you the position. The concept of psoas release, basically, it's using the ball to create a pressure to press on the psoas muscle to relieve the muscle tension. And how are you gonna find the muscle? You can see me do a little demonstration here. So you can find your belly button first, and then you can find your hip bone. So you got the 2-point belly button and your hip bone. Now find the middle point between both of them. And then you just place your tennis ball on top of it. That's how you find your psoas muscle. I'm going to actually demonstrate this exercise. So you maintain that pressure and then you lower down, lie down on your back. And then you can just apply the pressure on top of your hand. And then by doing this, you should be able to feel like you're applying pressure to the muscle. You will feel some tenderness, some soreness happening. And then if you feel like the tenderness and soreness is under the ball you are pressing, then you are on the right spot. And then to deepen the release, something you can do is you just bend and then straighten your leg to keep the muscles being engaged and then relax. If you guys want to try it, you can definitely do that too. You can just bend and then straighten your legs so that you can feel like the slowest muscle under, it's also being engaged and then being relaxed. That helps to facilitate more blood flow, and then that helps to ease the muscle tension. And then so other than bending and straightening your legs, another thing is you can just rotate your leg inside out, turning your leg inside out. That's another way to get the muscle engaged and then to release the muscle tension. And then we can also do this on the opposite side. Again, we find the belly button, we find the opposite hip bone, and then you place the ball between the hip bone and your belly button. Find the middle point, you press your hand on top of it. Maintain the pressure there, and then you can bend and straighten your knee. That's the way to relieve the muscle tension this way. And then you can also wiggle your foot inside out. So this is the very basic form about mobilizing and then releasing the tension of the psoas muscle. And then something you can do to progress that a little bit is you find the same position and then you lie down on your stomach. This way you will feel the pressure is increased a lot by lying down on your stomach because it's your whole body weight on top of the muscle. And then you can just lie down there, and or you can still wiggle your foot, your leg inside out. That can also help you to relieve the muscle tension. And then you can just bend and then straighten your leg this way. So that's the first technique, psoas release, that I mentioned in the handout. And then this one, it's not in the handout, but then it's also a tight muscle that can be released, which is the piriformis muscle. And then that's usually deep down in the hips, in the pelvis region. And then the way to do that, to release the tension of the piriformis muscle, it's easier to do that in sitting, and then ideally sitting on a chair. Sitting on the floor is doable, but then usually it's a more progressed, advanced version. And then that might feel a little bit more intense. Usually starting by sitting on a chair is easier. So to find the piriformis muscle, you can put your hand under your sits bone. Sits bone is like whenever you sit on the chair, you feel the most pressure of it. That's your sits bone. And then directly above your sits bone, like the soft muscular area, the piriformis muscle is usually deep down there. And then what you're gonna do is you put your tennis ball under that area. So it's right off the sits bone. The ball will be a little bit above. You just sit on top of it, and then you can cross your leg to the opposite side for a figure 4 position. And then usually by pressing the ball under that region, you should be feeling the pressure is under there, and then that's creating some muscle release there. Are you ladies able to feel that?
I'm still trying to locate the piriformis. And is it the same leg, the leg of the same glute, or the opposite leg that you put up on your knee?
So you will be putting under the leg, you move on top. Like right now, I'm moving my left leg to figure 4.
Right.
And so the ball will be under my left leg.
Okay. Okay, good. I think I feel it.
Yeah.
Because it's a little bit sore.
Yeah. So if you feel like if you feel some soreness happening, then you probably find the right spot. Mm-hmm. And then something you can simply do is you keep your spine straight. You just hinge at your hip and then come back up. That's an easy way to create some release at the piriformis muscle. It's the same idea like when I was doing the psoas release, I told you to or wiggle your leg or bend your knee to create some blood flow into that region. When you are doing the hip hinging right now, it's creating the same thing. You want to facilitate blood flow to that region. And then apparently, you can do the same thing on the opposite leg. So find your sits bone first and then put the ball directly above that. And then you cross your leg to the opposite side. And then sometimes, like I'm already noticing that my right hip is tighter than my left hip, so I'm not able to drop my knee down as much. But that's totally valid as long as you're not cranking through pain. You just need to feel the stretch, and then you place the ball under the muscle, and then to deepen the release, deepen the stretch, you hinge at your hip. So that's the second release technique that I'm showing you guys. Any questions with these?
One thing I forgot to mention, Andy, is that a lot of my pain is sciatic pain.
Uh-huh.
So I guess this would still apply the same, right?
Yeah,
Release.
definitely. Um, so the piriformis muscle actually it's very special because a lot of people, like 80 to 90% of the people, their sciatic nerve actually penetrates through the middle of the piriformis muscle. And then so if somebody has a piriformis tightness, the muscles is bulking up, having too much tension, then the tension can create pressure on the sciatic nerve. And then that's a big reason why a lot of people are having sciatica, the nerve pain along their entire leg, along their back leg.
Mhm.
Some people, sometimes it's because of the spine, yes, but then a lot of the cases, it's because of the piriformis muscle is having too much tension.
And I
And
guess it could be both.
yeah, definitely, that could definitely be both. And then also, sitting for too long for a lot of those cases is also another aggravating factor because if they don't sit in very good posture, they are directly applying pressure onto the sciatic nerve, onto the piriformis muscle. And then so those pressure just constantly staying there without moving around can also make the nerve angry and then creating the symptom. Like when I was showing you the technique, I told you to hinge and then ease out, right? It's a constant movement technique. So if you have a constant movement, that can facilitate blood flow, and then that is okay. But then for some people, if they sit in front of their computer, sitting there for 5 hours, 8 hours, not moving at all, that's problematic. And then that's the reason why that is an issue. Okay, so we talked about the release techniques, and then I also talked about maintaining the erect posture in sitting. And then now we can talk about the other aspect of the muscle balance, which is stability. And then for stability, I'm going to show you guys two techniques. The first one is to engage the core muscle. So you guys already know in sitting how to sit up right, find an erect spine posture. And then now to engage in your core, you feel like the first thing you will need to be breathing into your diaphragm, into your lower back, into your ab region. So it's not just breathing in the chest, not breathing in the shoulder neck. It's that when you are breathing down, you feel like the bottom part of your rib cage, the bottom part of your rib cage is expanding. So breathing into your rib cage and then come back down. So if you can put one hand at the bottom part of your rib cage at your diaphragm, you feel like you are really breathing into your hand. That's the way to find the diaphragm to engage the first part of the core muscles. You can also do another thing is you press one hand on your chest, another hand at the bottom of the rib cage. When you are just breathing regularly, you will feel like the pressure is going into both of your hands. And then now you can try to calibrate that and then put more pressure into your bottom hand, not so much on your top hand. So if you can feel like you are putting more pressure at your bottom hand, then you are engaging the psoas muscles, not the psoas, the diaphragm more effectively. And then that's the first part of the core muscle, the diaphragm. And then now the second part is considered the floor of the core, the powerhouse, which is the pelvic floor muscles. So the way to really engage those muscles is simply when you feel like you feel like you need to go to the bathroom, but then the closest bathroom to you is 30 minutes away, and then you have to walk for 30 minutes to get there. What would you do? You will actually hold it tight to hold the Kegel so that you can maintain yourself to actually go to that location and then you go to the bathroom. So you need to hold from underneath so that you can stop the urge, almost feel like you can stop the urge about going to the bathroom. Is that holding down there, holding your pelvic floor muscle. That's how you engage that. Another way, another good analogy of that is like you want to put on a very tight jean, and then how are you gonna do that to zipper that up? You need to squeeze everything very tight down there under your pelvic region. That's the way to find your pelvic floor muscles. So that's the first part, diaphragm. And then the second part, the pelvic floor muscles. And then now you can keep breathing. When you are inhaling, you feel like the pressure is going into your hand, and then you can feel like you are releasing, not holding anything at your pelvic floor. And then when you are exhaling, make sure you don't let go of your diaphragm. You still maintain the tension, but then you feel like you have even more of a squeeze at the bottom part at your pelvic floor. That's how you engage them. So you take an inhale, lower the diaphragm, breathe into your diaphragm, pelvic floor released, and then exhale, you squeeze your diaphragm more. And then you squeeze your pelvic floor from the bottom more. You inhale, lower the diaphragm, Now, this time you only release the pelvic floor about 50%. It's not 100% release. And then you exhale, diaphragm being squeezed, and then the pelvic floor engaged more. So keep breathing. So when you are breathing throughout the whole breathing cycle, you are just really minorly calibrating the muscle tension you are having for those muscles, but then there's no single moment of completely letting go. You always have a very mild muscle contraction happening at the diaphragm, at the pelvic floor muscles. And then now another component of the core muscles, which is the very deep layers of the abdominal muscles, the transverse abdominis, and then also the muscles at the back along our spine, the multifidus muscles. It's essentially forming a corset around our lower back. That's another component of the core muscles. So to think about it, it's like a corset with a zipper in front of you. So if you engage those muscles, you will feel like the corset is being tightened up. So when you are breathing in, the diaphragm is down. You breathe into your diaphragm. You have somewhat of a release at your pelvic floor, and then you feel like the zipper is going down, your belly is sticking out, everything is expanding. And then when you exhale, diaphragm coming up, pelvic floor narrowing, and then you lift, zipper up, feel like you are shrinking your lower back. So you feel like your belly button is almost feeling like it's going back, but then also going up at the same time. So you inhale, lower the diaphragm, partially release everything, and then exhale, you lift from the bottom up, and then you have a narrowing happening around your spine. That's the concept of engaging the core muscle, which is something very important whenever you are sitting, whenever you are walking. And Simone, like especially you mentioned, walking seems to be creating some symptoms of your lower back sometimes. Really think about engaging the core muscles, then constantly reminding yourself that will be something very beneficial to you. Initially, you might need to mentally really reminding yourself doing that all the time. But then when the time goes, it will be internalized, like it will become a habit, and then you don't have to keep reminding yourself. And then that's the thing of repetitions, and then you keep reminding yourself to make it internalized. That's uh, um, the importance of practicing this technique. And then so we talked about the core engagement. And then the next thing is another good exercise to help people to find the multifidus muscles along our spine, which is also part of the core muscles. Um, the reason why this technique is very important, and I need to address it separately, it's because whenever somebody is having a lower back pain, any cause, like any different types, the common thing is that the pain would inhibit those muscles, and then unless we do any active intervention, those muscles won't come back in to help stabilize the spine. We need to actively work on getting those muscles working. And, and then and then so now I'm going to show you guys the technique. It's called the long bridge. So you can lie down on your back again. So a normal bridge, your knees will be bent at about 90 degrees-ish. And then for a long bridge, your legs will be straightened out more to about just 30 degrees bent. And then you feel like you are digging in your heels into the floor. You're not even attempting to lift your pelvis up. You're just pulling your heels towards you, like the intention to bend your knees, but they're not actually moving. Then you can feel like the muscles in your back are somehow having some work and then engagement going on. Those are your multifidus muscles that you need them to be working to stabilize your back. An easier way to feel that is you can put your hands under your lower back. Just put your hands under there, and then now you pull your heels into the floor. Just by doing that, you should be feel like some muscles are being activated when you are pulling your heels into your back. Are you able to feel that?
Yes.
Yes.
Yeah.
Yes.
So definitely like so right now this technique is a valid thing to do to help you find the muscle, especially initially when somebody is experiencing any lower back pain or maybe any new episode of lower back pain. Because, like I said earlier, the pain would inhibit those muscles from actively stabilizing the lower back. So you need to do something to find those muscles back. But then later on, when you are practicing core engagement and then really carry over the core engagement into all your daily activities, the multifidus muscles will help you to stabilize your back better. So the long bridge is more of an initial, more foundational technique, but then eventually it will be carried over into core engagement and then also into all the activities you are doing. So these are the techniques in regards to muscle imbalance in the lower back in the pelvic region. And then earlier, I said the body position is very important for from the perspective of muscle balance. And then I spoke to Anna's situation a little bit, like for a lot of people, sitting for a long time seems to be a factor that's creating a problem. And then for some of the other people, sleeping is another thing. Sleeping posture, if it's not like if we're not being very mindful of how we sleep, that can also create some problem. And then ideally, sleeping on your back, you can maintain much more of a symmetry of your body, and then that's very important. But then a lot of people, they like to sleep on their side. Sleeping on their side is actually very important, and then positioning will be very important to maintain the symmetry when sleeping on your side, because if we're not maintaining the symmetry there, that can also create muscle imbalance, and then that can also create pain in the lower back, and then the muscles are not able to be relaxed throughout the whole night. So just want to quickly demonstrate a proper sleeping position, and then you might need a lot of pillows to position yourself. I'm going When you're sleeping on your side, you have to make sure the pillow is high enough that's supporting your neck. If you need to fold it in half, you can do that if the pillow is too small. But then right now, this is about good for me um, to support my neck. So that's the neck part. And then the second part is you put the pillow in front of your arms and then you can put your arm forward. It's supporting your arm and your shoulder. And then for a lot of people, if they don't do that when they are sleeping, the gravity would pull their arm forward and then it's very easy for them to have a twisting happening. You guys see that? Like the twisting is happening at the trunk.
Yeah.
If you have a pillow there, it supports your arm better, and then the pillow is kind of blocking me. So it's not that easy for me to twist forward. So having a pillow in place, that is definitely a much better way to support our body. And then another thing is we also need another pillow and then put that between our legs. So by doing that, my legs are more parallel to each other. Before me using the pillow, the top leg is being dropped down and then the gravity is also easier to pull my leg forward and then have a twisting motion happening at the pelvis. If I put the pillow there, the legs are more parallel. It's not that easy for me to twist because the pillow is kind of balancing the weight a little bit, so it's just not that easy for me to twist forward. So if you have enough pillow supporting your positions, you will be able to maintain much more of a symmetry of your body when you are sleeping on your side. So the idea is this: when you are sleeping on your side, your body should be as symmetrical as you are sleeping on your back. So that's the idea to keep in mind. And then that can definitely improve the sleeping quality for a lot of people. And then also to help facilitate the healing and then the muscle balance for some people having lower back pain when they are sleeping.
And
So,
I
mhm,
use a wedge
yeah.
for acid reflux. It looks like the wedges that you have around the studio.
Mhm.
Is that okay?
Yeah, that's totally valid. Um, as the main thing to keep in mind is how your body is feeling. Are you feeling enough of a support? Because if you don't feel like you are having enough of a support before you fall asleep, you will feel like your body is holding tension to prevent you from moving.
Mhm.
And then guess what? When you are falling asleep, you will start moving because your muscles are not holding the tension anymore. But then before you go into sleeping, if you feel like you are using all those different props, this can be pillows, this can be towel rolls for some people, this can be wedges as well. Like as long as you feel like you are having enough of a support that makes your body to be very relaxed, totally valid, do that. But then the idea, like I said, you want to make sure your body is as symmetrical on your side compared to lying on your back. So that's that's from the mechanic standpoint of how we can manage back pain ourselves. Now I want to dive into some other things that can also play a part in managing our back pain. We talk about sleeping position from the mechanical standpoint, but then sleeping itself is also a big factor. If we have better quality of sleeping, our body would heal better, and then the muscles would be relaxed more. And then that helps to ease some of our lower back pain. And then a very easy way to improve the sleeping quality is you have to keep it very regular. If you try to sleep at 10 o'clock, try to do that every single day. If you try to sleep one day at 8 o'clock, another day at 11 o'clock, you don't have the regularity. It's very hard for your body to adjust to your daily cycle of sleeping and awake. If you try to go to sleep at the same time every day, let's say 10 o'clock every day, your body would be adjust to that more easily. So definitely keep it regular. And then another thing is to keep the room cool. And then the suggestion is to keep the room temperature 20 degrees Fahrenheit lower to your body temperature. 10 degrees Celsius or 20 degrees Fahrenheit. So that means a lot of people, they like to make the room very, very cold. They turn on their AC very low. And then that actually would create even more of muscle tension because your body will be shaking to generate heat, and then you are not able to be in a relaxed mode of your body. 20 degrees Fahrenheit, that's the suggestion that can help your body to have a better quality of sleeping. And then we talked about the sleeping positions. So that's that. And then also another way to have a better sleeping quality is to exercise regularly. If you are consuming enough energy throughout the daytime, it will also be easier for you to sleep at night. Sleeping is the first aspect I want to talk about. That's something you can change from your lifestyle. Another thing is your diet. Try to eat a very diverse diet with many different source of ingredients that can help you to have better nutrients, and that helps with the healing process of your body. And then try to drink enough water. Water helps us to flush out some of the metabolic waste, and then that's a very important part of the healing process. We want to flush out all the garbage, all the bad things in our body to detox our body. Drinking enough water is very important. Try to eat enough vegetables, fruits, whole grains type of ingredients. The fibers is very important for our body. The vitamins, the nutrients in those vegetables and fruits are essential. And then they are also playing an important role in calming down the inflammatory process within our body. So those vegetables like the colored ones, and then the deep, dark, leafy green type of vegetables, spinach, kale, leafy greens, those are very important to be considered as the vegetables um, to facilitate the healing process of our body. And then you want to have healthful fat, the fat from nuts, from avocado, from olive oil, and then also some fat from deep ocean fish. Those are the fat that are considered very healthy for your body. And then there's another thing people talk about, the unsaturated fat. Yes, it has a benefit for our body, but then here it's something I would like to dive in a little bit more. You probably heard of omega-3 versus omega-6. So omega-3 is the unsaturated fat that can mostly be found in deep ocean fish. And then those are considered very healthy. And then that helps to slow down, calm down the inflammation process. So those are good. Omega-6, on the other hand, can trigger the inflammation process in our body. And then that can potentially make the back pain worse. There's no direct correlation, but then that can be a contributing factor. And then a lot of times, the omega-6 is rich in a lot of the vegetable oils like flaxseed oil, peanut oils, a lot of different types of vegetable oils. They have a lot of omega-6, and then that can potentially trigger some inflammation process in our body. So we people would recommend that olive oil would be the best choice of vegetable oil because it doesn't have as much of omega-6 compared to other types. And then lastly, we have to make sure we have adequate amount of protein intake. And apparently meat is a good source of protein. But a lot of people, if they don't like to eat meat, make sure they have enough source of protein from other sources like fish, seafood, or maybe some plant-based source of proteins like beans, mushrooms, or tofu. Like we need to make sure we have enough intake of protein that's also playing an important role in the healing process. And then nowadays, a lot of people like to follow a specific diet. And then there are a lot of different diet options out there. And then sometimes it's hard to follow. But then a very good principle is that most of the healthful diets are more alike than they are different. A lot of the principles I talked about, they are actually the principles followed by a lot of the different diet approaches. So these are very, very general guidelines that you guys can think about. But then very specific guidelines that specific to your body condition, definitely consult a registered dietitian, and then those would be the professionals that can give you more specific guidelines specific to your body condition. So that's nutrition. And then last but not least, regularly exercise, you keep your body in motion. We have a saying in the PT world, motion is lotion. When you are moving more frequently, the circulation would be better, and then the muscles will be stronger, and then also you will have better quality of sleeping, you will have better energy level. Exercise regularly definitely plays an important role in managing back pain. So that's that. We talked about sleeping, we talked about diet, we talked about exercise. Those are important pieces in your lifestyle that you can address. That's also playing an important role in managing your lower back pain. And then with this being said, this concludes the workshop for today. And then, so thank you so much for this hour